recording. Yeah.
Okay, so Lama, we're coming to the end of the interview now, and so I just want to recap on some things that we've discussed today. And with that being said, the things that we discussed is that you just recently came in um, into the clinic today for an intake because you were struggling with a recent overdose that happened approximately 3 weeks ago that resulted in you being hospitalized. You say that you overdosed on opiates, which was a prescription that was given to you from your doctors who put you on a prescription due to a recent injury that you suffered at work in which you broke your leg. You said that you were taking the medication as prescribed, and some things happened where you were laid off from work, and you found yourself continuing to take the medication over the dosage amount because you were struggling with some emotional issues here. And one of those things that you discussed was your issues with depression, that you had a recent diagnosis from a former agency that you're going to. You said at the time when you were diagnosed that you didn't get any prescriptions drugs to deal with your depression, and you didn't really receive a lot of counseling or therapy either. And so dealing with that depression that you've been diagnosed with for like approximately 7 years, according to your report, has become more weighing upon you as you have lost your job, and now you're suffering from picking up additional habits with the opiate use that's causing you to feel a little low and feeling as if you're, being a disappointment to your family and also a disappointment to your husband, who is really, struggling to hold down the house with the lack of income. You also mentioned there was some feelings of resentment that you feel that your husband has placed upon you due to you not having a job currently, and it's becoming a bigger stressor in your life. You discussed some other stressors as well, such as having to deal with your children's schedules and making sure that they are able to meet appointments and school functions and other extracurricular activities that they're involved in. You also stated that not having a really strong social support system was also a very big problem for you because you weren't able to really rely on other people, including your husband and your family members and your former friends that you felt that you had a really close contact with before the layoff. And so I know that those are some things we discussed. Is there anything that you feel that I missed in that?
No, I don't think so. I think you've covered everything. You know everything.
Okay. Well, I also want to capitalize on your strengths. You mentioned some really positive strengths. You said that you had did a former treatment program before coming in for this intake today. And so you said that you were able to complete that program very successfully, and it was really beneficial to you because it was able to give you some help. You said that you had a issue where you couldn't follow through with the treatment after you left inpatient because outpatient wasn't as successful. But when you were in inpatient, you were able to follow the structure of the program appropriately. You also said that you're highly motivated to get clean and sober for your kids as their number one priority in your life. And you also want to mend your relationship with your husband to make it stronger, make it where you guys can have open communication and build those supports with each other, whether you're in the community or in your home. I mean, you also talked about just wanting to change your overall lifestyle, and you're really motivated to, make those changes. So I see a lot of strengths here that we can work with in recovery. At this time, I want to make some recommendations here. You do have a therapist that you're going to be seeing right after you get through with our interview, in which you're going to go through some assessments so that he can get a formal diagnosis on you. So we want a formal diagnosis so that we can, actually see what it is that we're going to be working with concerning treatment planning. You also want to know exactly what kind of treatment goals we're going to be looking at exactly. So for preliminary purposes, one thing that I am going to suggest here, just giving you some feedback, I am going to suggest inpatient treatment again. Now, I know that could be a big deal because it does require you coming into the clinic, staying for approximately 45 to 60 days, getting your goals outlined and working those goals and being successful in treatment. And I know that could be a little problematic if you have children. So if we suggest inpatient treatment today, how do you feel that you're going to be able to work with that in your schedule with your daily life?
I will ask my family to help me to do it, and I can start doing it right away.
Okay. So you do feel strong that you can do inpatient and do well. Is that what I'm
Yes,
hearing? Okay, that's
yes.
great. I love to hear that. I love to hear that. And so you feel that your family will be supportive of the inpatient treatment.
I think so because they want me to get rid of all these issues.
Okay, that's great. I love to hear that. So definitely want to recommend inpatient treatment. I'm also going to recommend some Al-Anon services for your family so that they can get support because this can be a difficult time not just for clients but for clients' families as well, as they will be struggling without having you in the home and dealing with the emotions that comes with just dealing with substance abuse issues and dealing with the ramifications of addiction on the family as well. So I'm going to go ahead and give you some resources for some Al-Anon treatment centers and some Al-Anon groups that your husband and your children can go to so that they can voice their opinions and also express their emotions as well. In addition, I'm going to recommend NA and AA groups. So NA is Narcotics Anonymous and AA is Alcoholics Anonymous. And really those two groups are quite similar, just a different way of looking at different drugs. But what they're going to do is give you support. And so even though if you don't feel as if you have strong peer supports, they're going to be there to help build those strong, peer related abilities to talk to other people who are going through similar things that you're going through. We do a lot of AA and NA groups here in our clinic. And so we have people come in and voice those experiences and allow you guys to have one-on-one interaction and feedback with them. So I'm going to definitely recommend AA and NA as well. So with those recommendations, are you okay with all three of those? NA, AA, Al-Anon for your family, and also inpatient treatment for you?
Yeah, yes, for sure. Yeah, no problem.
And that's great. So some of the goals we're going to be working on is relapse prevention, as relapse is probably going to be an issue that you struggle with in your past since you did have a former treatment and then you relapsed and began using the substances again. So I'm also going to recommend some alcohol and drug education, just so you know what you're putting in your body, some of the things that we consider to be very hazardous to your health. I really want to make sure we give you some information on those so you know exactly the drugs that you're using, as a lot of people tend to not know or have a lot of information on those. So I definitely want to give you some of those resources for your goals. We're also going to be setting you up with a treatment team. And what their job is going to be is to meet with you weekly, several days out of the week. And what they're going to be doing is working on the goals with you, giving you resources to complete the goals, using interventions for you to complete those goals, and helping you to gain insight into how you're doing in the program and your successes as well. Is there any questions that you have concerning your treatment team and some goals that you may be looking forward to setting with them?
No, thank you. I don't think that I have any question. Thank you. Maybe when we started, I have new questions. When we start implementing these recommendations, maybe I have some questions. Can I contact you in this case?
Yes, of course. You can talk to anyone on your team. You can talk to me. You can talk to your therapist specifically. I would love for you to talk and have the open communication with your team, as I may not be a member on your team, but I'm definitely a resource within the facility that you can contact if you would like that information. And finally, some of the therapy that you're going to be experiencing is cognitive behavioral therapy. And so that's where we're going to try to align your thoughts and your behaviors together on one plane so that you're acting on thoughts that you actually want to act on, and being able to thought stop and block thoughts that are negative, or to have more positive thinking, as I would like to say here. So is that a therapy that you're interested in?
Yeah, we can try.
All right.
Okay.
Do you have any specific therapy that you would like to work with? Any kind of specific interventions or techniques?
No, I will go with your recommendation.
Okay, that's good to hear. So at this time, I'm going to ask for any final questions that you may have. Do you have anything that you really want to ask, or any concerns that you're aware of concerning inpatient treatment or Al-Anon services, anything that we discussed today?
No, thank you. I think you covered everything today. Thank you. And I will start right away with your recommendations. And as I told you, if there is anything, I will take the contact numbers and I will ask the people. If
That's fine. And that's totally fine with me. At this time, I'm going to go ahead and end our interview and get you over to the therapist so that he can do his assessments. But before that, I will allow you to grab a couple of snacks from our break room as you wait for the therapist. And I'm going to give you some resources while we're out there, some pamphlets and brochures concerning our program and any other additional resources we happen to have within our community. Okay?
Okay, thank you.
Thank you for coming in. I'm so glad you came in today. I know it was a hard decision to make, but I'm so happy to have you here.
Thank you.
You're welcome.
Okay, that was great.
Thank you.
Okay, so let's start now, okay? Okay. Okay, Shamika. Hi, how are you today?
I'm doing good. How are you?
Fine, thank you. So you are here for the follow-up after our meeting last time. Last time you talked about your son. You talked about the problem that he has, problem behaviors that he has, and the aggression behaviors. He has hitting, biting, screaming, whining all the time. And you talked about his sleeping cycle are irregular. He doesn't sleep during the night more than 4 hours, which cause problem for your all the family, for you, for your husband, and for other children in the house. You talked about his feeding problems, that he had very picky about his food. He can't sit down and eat during the meal times. He keep moving around and he spells everything around him. So I was also, we talked about his communication skills, that you want to improve his communication skills as he doesn't speak, just babbling some sounds. So we need to work also on, you have some issues about his communication. You want to start to communicate with him well. So at the same time, I know that you are willing to, you and your husband are willing to do any treatment for him. You can come to training. Your parents are willing to help you to during this time with your other children. So I really, these are very good resources to start with it. Do you have any questions before I say my recommendations?
I do have at least one question. My concern is that with him having all these issues and these behaviors, it's easy for his whole life to become services. And I understand that he needs these services to sustain and to be functional in the community with his peers. But I don't want him to feel as if he's just the sick kid or the kid with all the problems. So is there a way that we could structure his services when he's, possibly, I would like to do it where it's a little bit in the home and a little bit at school. I know he has a lot of these behaviors in both of those environments, but I would like to make it where he has some services in the day at school, some services in the evening, so that he can spend at least some portion of those periods in those environments being just a normal kid. And that's what I'm really concerned with. So is there any way that we can ensure that he's going to be okay in these environments and get the services, but not overwhelm him with services?
Yes, for sure. Yeah. So you said that you want him to feel like to minimize the services time as much as we can. This is what you need, right? Yeah, we can do that. We can arrange with his school just to for him to be pulled out of the school just in the certain times, and this doesn't have to be all over the week. We can choose some days where other children have some activities that maybe he doesn't like to join that much at that stage, and we can put him out of the classroom to go for the services. At this in this case, he will not feel that I am different than my other colleagues in the class. At the same time, he's doing something that he likes at that time.
Okay.
At home, it's the same thing. We can arrange the schedule in a way that we don't want you to just to be related to this service the whole week. We can arrange a few days in a week. We can arrange together according to your schedule and your husband's schedule as well. So that will not be a problem at all. The thing that I want to start with I want to start to make an assessment as soon as possible for him. But for this assessment, I think he has to come to the center for a few sessions and until we finish the assessment, because I would like all our team to work with him, so to know him very well and to know his abilities very well. So in this case, we can come with a better treatment plan for him. So this is my first recommendation. The second recommendation, I would like to go and observe him at school first for a few sessions, and I can arrange with the school the timing in according to their observation first, which classes he has the most behavior in. So I can arrange my schedule to go there and go for observations before I make any recommendation about his behavior at school. For his communication, we can start right away with the communication. I would like to start with the communication with the MAND program that will help him to ask for his needs easier than he's doing right now. And I hope that will also decrease his behaviors, his aggressive behaviors. For the sleeping problems, maybe I will give you the login book. I want you to write for me whenever the time he goes to bed, the time that he wakes up during the night, and what kind of behavior does he have when he wakes up during the night.
Okay, I can definitely do that. I can keep a log and keep it organized.
Perfect. Yeah. What about, would you like me to contact the school, or you want to contact the school first and tell them about the observation that I want to come and do it there?
Let me contact them first so that they get a heads up from me and make sure that I'm on board. I want them to know that I do consent to this process. So I'll let them know that you're coming, and I will give them your information. And I know I might need to sign some release forms as well, so I'll definitely sign those for you, so that you can come up to the school and meet with him and do the observations. And they're pretty accommodating, so I don't see any issues with you being able to come in. So
good. So you said that they will be cooperative and they will not have any issues for me to go and observe.
They're pretty cooperative. I know there's other kids in his class that struggle with similar behaviors, and I've seen he's come home and talked about how, there's been people in the school watching, so to speak, the behavior. So he's aware that people have been in there for other kids. So I'm sure other kids will understand something, is going on. So I don't see it being a problem. They seem accommodating in other issues as well. So, and they're pretty open school and open to diversity and understanding the different needs of different kids. So I don't see this being a problem, but I will definitely give them a heads up so that they know you're coming in.
Perfect. So that's nice to hear as well, that I will be with the supportive people around me. That helps me a lot. Perfect. Yeah, then also for his feeding problems, and this is another program that I want first to observe him. I will do that during the assessment sessions. Maybe we'll have you will send with him some snacks that you would like him to eat, some type of food that you would like him to eat, and I want to see how he is behaving when he sees these kind of food. Does he refuse them from the first sight, or does he try something? I want to make this observation, and I will let you know about all the results of all these observations. Do you have any questions for me?
No, you pretty much outlined everything that I had concerns about. My one concern was addressed, which is just the normalcy. I want to maintain the normalcy of his childhood. But other than that, you pretty much answered everything that I have on the table. As long as we continue to work, and if there becomes any problems, we'll talk about those and work them out as we go. I know this isn't a foolproof process, but definitely I will understand working this out and getting to some underlying issues, of course, with his behaviors. But I have no more questions at this time. I'm just glad that we've been able to discuss these issues.
Okay, so I have your email address. So I will send you some articles that talking about the assessment that we are doing, talking about some recommendation how to solve the sleeping problems, and how some recommendations how to solve feeding problems as well, and mealtime problems behaviors. Is that okay? So we can read it in the meantime until we meet next time. And until we meet next time, if you have any questions, you can email me right away, and I will wait for you to send me the forms that you have to take from the school, fill it out and scan it, send it to me, or send it to me by mail, whatever you feel easier for you. I will wait for this, and we can go from there. Is that okay?
That's perfect. Thank you.
You are welcome. Thank you. And I'm happy that you are here today. And we'll keep in touch. If there is anything, I'm always ready for you. Okay?
Okay.
Okay. Thank you so much, Shamika.
Thank you.
Okay, here we are. Stop recording. Yeah. Okay.